If you have tendinitis and widespread joint pain, you should care about collagen and how you should take care of it. Because maybe if we took care of our bodies a little bit better, we could ward off some of that tendinitis so that you don't get it all the time at various body parts. Because if you're a woman in the perimenopause, menopause transition, you're getting tendinitis here, there, and everywhere because you're basically inflamed all the time. So let's get nerdy. So collagen are these flexible fibers that have the ability to take a high tensile load. So collagen fibers are very, very strong because they can take that load. Collagen is very, very strong at the structural level. There are covalent bonds. They are little intertwined polypeptide chains. And the majority of your collagen is a type 1 collagen. This type of collagen makes up 90% of the body's collagen. It's found in your skin, your bone, your fascia, and your tendons. Type 2 collagen is your cartilage. And I'm not talking about your type 2 collagen today. The type 3 collagen is arranged in a mesh-like pattern and doesn't take as much tensile load. And these fibers are in the boundary, they surround the tendons, they surround blood vessels, they surround nerves. And it is the type, when you are healing, it's the first type of collagen to come in when you have a scar. And all of this collagen is made by a fibroblast, which fibroblast build. And collagen fibers kind of align based on the load that is placed upon them. So you want to load the tendons so that they can become stronger, because if you don't use it, they kind of atrophy and become weeny, just like muscles. And in problem situations, let's say you broke your arm and you were casted, well, there's increased cross-linking and the collagen isn't moving and sliding the way it should. There's going to be a chemical soup that surrounds this pathological thing that makes the density of the ground substance not so good. And then the collagen gets too close together and it makes cross-linking, which is what we do not want. Fun fact, EDS is a connective tissue disorder that is a genetic mutation that makes an imbalance with the type 1 and type 3 collagen. So let's talk about why the tendinitis keeps happening. Okay, your estrogen helped broker inflammation, and your estrogen is important for your collagen turnover. Now, you are also losing strength, so your muscles are not controlling your limbs and your joints as well. There is more strain being placed on the tendons. Your tendons are going under a high rate of stretching and basically causing inflammation and making the fibroblasts more susceptible to stretch. And if there's that continual stretching and the fibroblasts keep stretching, then there's going to be more inflammation, and then there's going to be more COX-2 and COX-1, which are pro-inflammatory enzymes, which is why medication-wise you take a COX-2 inhibitor. So overstretching the tendon, repetitive overuse leads to stretching the fibroblasts, which leads to inflammation, which leads to more pro-inflammatory enzymes like COX-1 and COX-2. And that's just one piece of the soup. Now, rehab-wise, this is why we use eccentric strengthening to help give the fibroblasts a boost. The thought is the eccentric exercises will give the fibroblasts a greater stimulation and will increase collagen synthesis.